Good morning. Thank you for the opportunity to introduce our work on AI-enabled pre-screening system. My name is Quanzheng, known as Q at MGH. So one of the biggest problems in our day for the healthcare system is the physicians are too busy, but the patients cannot wait, particularly for some critical conditions like pneumothorax we are going to talk about. And in a lot of hospitals in the ER room, there is no radiologist on site for 24/7. Our solution for this challenge is to use AI-enabled cloud-based systems for pre-screening. For example, what we try to do is that traditionally, if you have a scanner, usually you get the images pushed into the PACS and wait for the radiologist to review these cases. But what we try to do is that while the image push into the PACS, we also get it to the cloud so that we are going to deploy AI algorithms in the cloud that can immediately have a detection or a decision on this case. If necessary, it will alert the physician to take some immediate intervention. So this will provide immediate impact on the patient's outcome. We believe that if there is one area that AI have a direct and immediate impact, that will be the cases in the emergency and the critical conditions. So there are a lot of applications in this category, but we take the first target as the detection of pneumothorax. There are about 7 to 23 pneumothorax among 100,000 people every year. And some percentage of these cases, you need to have intervention in 1 hour to avoid a bad consequence. And for some cases, that the subject has no typical symptoms. And sometimes this is dangerous because, for example, if the subject has a small pneumothorax and he goes to take a flight, in the up air, the air pressure change and the pneumothorax can enlarge and break and cause internal bleeding. That would be a disaster in the airplane. So it's kind of dangerous in many cases. If we have a system that can automatically, quickly detect this event, that would be wonderful. It's going to be good for the healthcare system. It's provide a high quality, high efficient, and cost-effective system. And it will significantly reduce the work for radiologists. And for patients, it's life-saving technology. So here is a case of pneumothorax. This is the CT images. The red region on the right is the pneumothorax region. In this case, it's quite irregular. The shape and the size of pneumothorax matters. And we don't have competitors at this stage right now. So the technology we developed is shown on this chart that is including a complicated pre-processing stage and a deep learning neural network and a post-processing stage. And on the right, we show an example. This is a typical CT of a pneumothorax subject. We use patch-based neural network to do the detection. And here is an annotation from a radiologist at MGH. In the bottom, we show that the segmentation of lung region and the detection of pneumothorax region. On the right, we displaced the pneumothorax region only. So the size and the shape of pneumothorax matters in this case. We already test this algorithm among more than 200 subjects. The accuracy is quite good. The subject-wise sensitivity is about 100%, and the specificity is about 88.5%. In the pre-screening case, the sensitivity matters. In this case, 100% sensitivity, meaning that we detect all the cases. But as a scientist, we are curious about what's happened with all this false positive. We go to look into it. We found there are 5 cases of emphysema, and 11 cases is caused by the metal artifact in the CT images. So we further develop a neural network to also detect pneumothorax and reduce metal artifact. In this case, we believe that soon we can boost the performance of specificity to about 95%. Even without that effort, this system is already ready to deploy it for triage of radiology images in the ER room. So the current status of this project is that the prototype system has been developed, and we have tested in the pseudo real-time in the clinical workflow, meaning that once the radiologists see a suspicious case, they push to us. We do a detection at the same time while the radiologist reading the cases. We actually find one case that the subject has no idea that he has pneumothorax and plan to go to the airport in the second day. We stop this person to go to the airport. And we test over more than 200 cases. So the competitive advantage of this project is that we are really multidisciplinary teams that including computer scientists, engineer, and physicians. And another lucky point for us is that we have really high quality, well-annotated data. During this process, we have developed a pipeline for the pre-processing, post-processing, and deep learning so that it can process a lot of chest CT for critical conditions. As I said, that we developed multiple networks to reduce the false positives. So in the future, the next step, we want to commercialize this project. We need additional validation on various scanner and protocols. We want to make the system more robust. We want to do a human observed study to compare the performance of radiologists and the computer. We want to apply it in the real clinical workflow. Most importantly, we want further extend this program to detect pneumothorax using chest X-ray. In a lot of developing countries like China, India, X-ray CT is not commonly used in ER room, for example, but chest X-ray is widely used. Fortunately, at MGH, we have a large data set that for all subjects, they have both X-ray CT and chest X-ray. We can do a training on this data set and learn the mapping from chest X-ray to X-ray CT. And when we do tests, we can only use chest X-ray to do the test. That will greatly increase the usage of this system. We also want to apply this technology to a lot of other critical conditions like emphysema, ACOS, which is a combination of asthma and COPD. To use it to reduce the metal artifact, to do bone fraction detection, and to detect tubes in the ER and ICU, to detect stroke, aneurysm, and use ACG to detect a lot of critical conditions. The text with blue means that we are already either have a system or working on a system to detect this disease. The technology can be deployed either on a smart device like a CT scanner or deployed on a smart cloud to help the PACS system. And I'm here to looking for collaborators and investors to move forward this project. And I'd like to thank my postdoc, Sean Lee, and my collaborators, Dr. James Straw, Dr. Manu Kara, and Dr. Supa Dikumasi. It's even difficult for me to remember his last name. Like nobody remember pronounce my first name correctly. Thank you for your attention.